Hi friends, today in this topic of journal examination, I will talk about temperature. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only, and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Coming to body temperature, the core body temperature. It usually refers to the temperature of the internal body core. It is measured under the tongue, in the ear canal, or the rectum. Normal oral range temperature, temperature range for oral temperature is 98.2 plus minus 0.7 degree Fahrenheit or 36.8 plus minus 0.4 degree Celsius. As we know that regulation of the temperature is under the control of neurons of the preoptic anterior hypothalamus and posterior hypothalamus. Various sites at which we check the temperature are oral temperature. The probe is placed under the tongue into the sublingual pocket and the lips closed around the instrument, that is thermometer. The patient should not have recently smoked or ingested cold or hot food or drink. It is usually tested for about 3 minutes. Oral temperature reflects the changes in the core body temperature through the branch of external carotid artery which perfuses the posterior sublingual pockets. Second is the rectal temperature. Rectal readings are 0.4 to 0.6 degree higher than the oral recordings, and it is measured with lubricated blunt tipped glass thermometer which is inserted 4 to 5 cm and in children to 2.5 cm into the anal canal at an angle of 20 degree from the horizontal, with the patient lying in prone position. It is usually tested for about 3 minutes. It lags behind the changes at other core site as it is located far from the central nervous system as well as from the pulmonary artery. It indicates a deep visceral temperature, and it can be affected by the temperature of the skin of the buttock, the iliac artery, and the iliac vein. Tympanic temperature. The scanning tip of thermometer should be gently placed in the ear canal and then slowly inserted against the tympanic membrane snugly. It measures the infrared heat waves from the tympanic membrane. Since it is close to the hypothalamus, rapid measurements of the core body temperatures are seen. The axillary readings, they lag behind the oral temperature by 0.1 to 0.2 degrees Celsius. Here the thermometer is placed in the axilla and the axilla should be adducted. It is convenient for the patient, and the core temperature cannot be assessed directly. It lags behind the changes in the core body temperature. Next is the temporal measurements. We have to place the thermometer on the skin of the forehead on the skin of the forehead we place an electronic thermometer, and this is fast and accurate. It is less invasive than the tympanic thermometer, and it is more reliable when used correctly. Coming to thermometer. Thermometers are either glass thermometer or electric digital thermometer or infrared thermometer. Glass thermometers and electrical digital thermometers. In glass thermometer, the bulb contains an alloy called galliston. Electric digital thermometers are more convenient than the glass instrument because the probe cover is disposable and response time is quicker, allowing accurate measurement within 10 to 20 seconds. There is a signal when the rate of change in the temperature becomes insignificant. Means when we use digital thermometer, when it records the temperature in 10 to 20 seconds, then there is a signal that it beeps when the rate of change in temperature become insignificant. This is the thermometer which shows this glass thermometer. On one side it has a Celsius scale, on other side it has a Fahrenheit scale. Digital thermometer, it is inserted into the axilla, or it is put in the mouth and gives you the digital reading. And third one is the infrared thermometer, which we can put the infrared rays on the forehead of the patient or any skin surface, and it will give you the reading. It is almost contactless, as it was used in the COVID era. So there are safe ways to check temperature that don't hurt the patient. These are oral, rectal, armpit or vaginal thermometer. Here we can use digital or glass thermometer. Special thermometers for forehead, ear and temporal artery are there. In children's we can use strips that change color to show temperature. These methods are used in hospital and at homes. And more invasive methods like probe or catheters, though they are more accurate, but there are risk of complications. So they are only used in critical care or during the surgery. Coming to circadian variation of the temperature, as we know that circadian rhythm, it is governed by the suprachiasmatic nuclei in the anterior hypothalamus. Normal variation in the temperature is 0.5 to 1 degree Celsius over the day. Lowest temperature is noted at 6 a.m. in the morning, and it peaks around 4 to 6 p.m. in the evening. Similarly, we see the variation in the temperature during the menstrual cycle also, and during menstrual cycle, before that we can see there is abrupt increase in 0.3 to 0.5 degrees Celsius temperature during ovulation, and it may be helpful or useful as a fertility guide. Coming to fever, we know that fever is an elevation of the body temperature that exceeds the normal daily variation, and it occurs in conjunction with the increase in hypothalamic set point. It can be defined as a temperature of more than 37.2 degrees Celsius or 98.9 degree Fahrenheit at 6 am, or more than 37.7 degrees Celsius or 99.9 degree Fahrenheit at 4 to 6 pm in the evening. When our body thinks it is too cold, it tries to warm up by shivering to make or to generate the heat, moving blood to the core to keep it warm, stopping sweat to keep the heat in. And when our body thinks it's too hot, it cools down by sweating to lose heat, letting heat escape through the skin, and this happens naturally throughout the day and can also be affected by various illnesses or medicine. The different patterns of the fevers which are seen are continuous or sustained fever. It is defined as fever that does not fluctuate more than 1 degree Celsius or 1.5 degree Fahrenheit during 24 hours, but it does not touch the baseline. It is seen in lobar and gram-negative pneumonia, typhoid, acute bacterial meningitis. Second is the remittent fever. It is also defined as fever with daily fluctuations exceeding 2 degrees Celsius, but it also does not touch the baseline. Continuous fever has fluctuation not more than 1 degree Celsius, and remittent fever has fluctuation more than 2 degrees Celsius, but both these fever, they don't touch the baseline. This remittent fever is seen in infective endocarditis, rickettsial infections and brucellosis. Coming to intermittent fever, it is defined as fever which is present only for several hours during the day, and it is seen in malaria, pyogenic infection, tuberculosis, schistosomiasis, lymphoma, leptospira, borrelia, kala azar and septicemia. Double quotidian fever means which occurs 12 hourly, and it is seen in kala azar, gonococcal endocarditis, adult onset Still's disease. Quotidian fever means periodicity of 24 hours. It occurs every 24 hours. It is seen in mixed falciparum and vivax infection. So double quotidian fever is which occurs 12 hourly, that is seen in Kala-Azar, gonococcal endocarditis, adult onsets, Still's disease. Quotidian fever is which occurs every 24 hours. It is seen in falciparum and vivax malaria. Tertian fever which occurs after every 48 hours, though these pictures are very rare nowadays. And this tertian fever is seen in Plasmodium falciparum, ovale and vivax. Quartan fever which occurs every 72 hours, seen in Plasmodium malaria infection. There is another variety of intermittent fever, that is Pell-Epstein fever. It is intermittent low grade fever which is characterized by 3 to 10 days of the fever with subsequent afebrile period of 3 to 10 days. Means 3 to 10 days patients have fever, then there is a gap of afebrile periods, and again after that he again have fever. And this Pell-Epstein type of fever is seen in, though it is rare, but it is seen in Hodgkin lymphoma. Another is the relapsing fever. It refers to those cases that are recurring and they are separated by periods of low grade fever or no fever in between. And it is seen in malaria, lymphoma, borrelia, cyclic neutropenia, and rat white fever. Depending upon the duration of the fever, we can categorize them as acute fever, subacute fever, and chronic fever. Acute fever, which occurs less than 7 days, means duration of the fever is less than 7 days. It occurs in infectious diseases such as malaria, viral related upper respiratory tract infections. Sorry, here is they have jumbled up. Then subacute fever, it is usually fever which duration is less than 2 weeks, and it is in typhoid fever, intra-abdominal abscesses. Chronic fever, where the duration of the fever is more than 2 weeks, or here it is seen in chronic bacterial infections such as tuberculosis, viral infection like HIV, cancers, connective tissue disorders. And depending upon the degree or Celsius, we can categorize them as mild, low grade, moderate grade, or hyperpyrexia. As we know that normal body temperature is 98.6 degree Fahrenheit to 100.4. Mild or low grade fever is when it is 100.5 to 102.2 Fahrenheit fever. Moderate grade is 102.2 to 104.4. High grade fever is when it is more than 104.1 to 106, and hyperpyrexia is when the fever is more than 106.6. How can we convert the Celsius into Fahrenheit or Fahrenheit into Celsius? To convert Fahrenheit into Celsius, we know that 1 degree Fahrenheit is equal to 9 by 5 of Celsius plus 32, and to convert centigrade into Celsius into Fahrenheit, just it is 5 by 9 of the temperature minus 32. 5 by 9 of the Fahrenheit temperature minus 32. These are the various clinical patterns of the fevers. Like as we know that this is the first figure is the continuous type of fever which is seen in typhus, viral pneumonia. Then coming down in the first column, remittent fever seen in typhus, sepsis, tuberculosis, rheumatic fever. Then we have intermittent fever seen in pleuritis, sepsis. And coming to second column, first this is a recurrent fever seen in malaria, brucellosis, cholecystitis. Then we have undulating type of fever seen in brucellosis, tumors like Hodgkin disease, and some viral infection they may have biphasic fever. So some specialties about few fevers. The fever which occurs with night sweat, it has been described in patients with TB, nocardia, brucellosis, liver or lung abscess, subacute infective endocarditis, as well as some other non-infectious diseases such as polyarteritis nodosa and lymphoma can present with fever with night sweats. Fever with bradycardia It is seen in untreated typhoid, leishmaniasis, brucellosis, Legionnaire's disease, psittacosis, and yellow fever. Fever of unknown origin. Initially in 1961, the pyrexia of unknown origin was originally defined by Peters, Dorff, and Beeson as an illness of more than 3 weeks duration, fever higher than 101 degree Fahrenheit on several occasions, and diagnosis uncertain after 1 week of study in hospital. The definition has been modified now, removing the requirement that the evaluation must take place in the hospital, and refined to include four different subgroups, such as include four different subgroups, each requiring different investigation strategies: classical, nosocomial, neutropenic, and HIV related. Hyperpyrexia is when the body temperature exceeds the 105 degree Fahrenheit. The causes they include pontine hemorrhage, rheumatic fever, meningococcal meningitis, cerebral malaria, septicemia, encephalitis, serotonin syndrome, thyroid storm, neuroleptic malignant syndrome, aseptic fever is seen in malignancy, acute bacterial infarction, sarcoidosis, chronic renal failure, collagen vascular diseases, drug fever, radiation sickness, post surgical patients. Drug fever, it is a prolonged fever with relative bradycardia and hypotension. It persists 2 to 3 days even after drug is withdrawn, and it is associated with rash and eosinophilia. For example, penicillin, procainamide, propylthiouracil, sulfonamide, anticonvulsants, they can cause drug fever. All drugs they can cause drug induced fever except digitalis. Coming to nature of defervescence, the nature of differences may also provide some diagnostic clue. The defervescence, if it occurs by crisis, it occurs within hours. Example is effective antimalarial therapy in fever can lead to defervescence by crisis, seen in remittent fever, intermittent fever. Defervescence by lysis, it is fever subside gradually over days. Example is typhoid fever. Resolution occurs by lysis following effective antibiotics. Disorders of the increased body temperature, like hyperpyrexia, when the body's temperature regulation mechanism set the body temperature above the normal temperature, then generates heat to achieve this temperature. The body's temperature regulation mechanism sets the body temperature above the normal temperature and then generate heat to achieve this temperature. Hyperthermia is unchanged or normothermic setting of the thermoregulatory center in conjunction with the uncontrolled increase in body temperature that exceeds the body's ability to lose heat. Heat stroke, it is acute condition of hyperthermia that is characterized by prolonged exposure to excessive heat and humidity. Excessive heat plus humidity. The heat regulation mechanism of the body eventually become overwhelmed and they are unable to effectively deal with the heat, causing the body temperature to climb uncontrollably. Malignant hyperthermia, it occurs in individual with inherited abnormality of skeletal muscle sarcoplasmic reticulum that causes a rapid increase in intracellular calcium level in response to halothane and other inhalational anesthetics or to succinylcholine. Neuroleptic malignant syndrome, it is seen in patients with neuroleptic use antipsychotic phenothiazine, haloperidol or prochlorperazine and metoclopramide, or with withdrawal of dopaminergic drugs characterized by lead pipe muscle rigidity, extrapyramidal side effects, autonomic dysregulation, and hyperthermia. Coming to hypothermia, it is defined as when the core body temperature is below 95 degree Fahrenheit. Mild hypothermia is when the temperature is between 90 to 90 degree Fahrenheit. Moderate hypothermia is when the temperature is between 82 to 90 degree Fahrenheit, and severe hypothermia when the temperature is below 82 degree Fahrenheit. Profound hypothermia is the term used when the temperature is below 75 degree Fahrenheit or 68 degree Fahrenheit, 75 degree Fahrenheit, 68 degree Fahrenheit. The causes of hypothermia are when there is decreased heat production or increased heat loss. Decreased heat production is seen in hypopituitarism, hypoadrenalism, hypothyroidism. When there is impaired thermoregulation as seen in CNS trauma, stroke, toxicological and metabolic derangement, intracranial bleeding, Parkinson disease, CNS tumor, Wernicke's disease, multiple sclerosis. The various heat and the causes which can lead to heat loss are burns, cold immersion injuries, vasodilatation from the pharmacological or toxicological agents, cold infusions, over enthusiastic treatment of the heat stroke, and there are some miscellaneous causes that can also cause hypothermia like sepsis, multiple trauma, pancreatitis, prolonged cardiac arrest, or uremia. There are some named fevers like glandular fever is term used for infectious mononucleosis fever. Papatassi 3 days sandfly fever is phlebotomous fever. Malta undulating fever is the term used for brucellosis. Relapsing fever is seen in Borrelia recurrentis, Laus B. detoni tick. Gold fever is seen with Rickettsia prowazekii. Rat bite fever is Spirulum minus. Trench or 5-day fever is seen in Bartonella quintana. Uria fever is seen with Botronella bacilliformis. Q fever is seen with Coxella burnetii. 7 days fever is seen with Leptospira bedmodis. Pontiac fever is seen with Legionella. Monkey fever is seen in KFD. Biphasy fever is seen with dengue, Kala-azar, chikungunya, polio. Valley fever is term used for coccidomycosis. Dum-dum or Bodwan fever is used for Kala-azar. Brazilian purpuric fever is the term used for H. aegypticus. William Osler has said, a good doctor treats the disease, a great doctor treats the patient who has the disease. With this, I conclude my today's topic. Thank you. Keep learning.